Hi there, Holistretch fam. My name is Frances Eve, and today I will be sharing with you an assisted stretch video. For learning purposes, I have chosen to divide this video into lower body stretches and upper body stretches. So for the first half, you will practice lower body, and the second half, you will practice upper body. Typically during my stretches, I sort of mix them both, but for these purposes, enjoy the process. All right, first of all, we want to go ahead and feel around our client's low back, glutes, and mid back. This is called a palpation process, and you're palpating the body with the palms of your hands, pressing down just to notice where any dense fascia is or where the sciatic nerve pain might be coming from. With my client here, his sciatic nerve pain was really coming from his glutes. So the glute area was the tightest area on his whole body. And so I like to take my olecranon and just lean my body into the glute, into the largest part of the glute. So I'm not jabbing him with my elbow. I'm actually just leaning my elbow with my body weight into the tightest part of his body. So always be aware that your movement comes from your body. It actually comes from your feet planted on the ground. So always make sure you have a nice grounding with your feet before moving forward towards your client's body. We're going to go ahead and lift up the client's right leg. So just going and bending their knee. And what you can do is really cool if you haven't tried this already, but what happens when you rotate their lower leg is that you get different angles in their hips and their glutes. So as your elbows gently pressed into their hip, you can actually rotate that lower leg and get different angles of pressure. So some angles where the foot comes a little bit in towards their midline and you're adducting that foot, you might notice that your client feels a lot tighter, or it might be the opposite way. If they are tighter on the outside of the leg, you can abduct that foot and you might feel a lot more pressure in this angle. As a practitioner, it's important to breathe just as much as it's important for your clients to breathe. So as you come and relax out of the stretch, you want to inhale. And then as you come into the stretch, you want to exhale with your client. Verbally exhaling or exhaling a little bit louder also helps your clients remember to breathe. All right, shaking that leg out. We're going to go to the other side now. So palpating their left side body, palpating the mid back, low back, and glute. And again, his tightest area was here in the left hip. So pressing the olecranon into the glute and then grounding my body into the ground and then shifting my weight forward. That helps me create pressure onto his body. So I'm not jabbing him with my elbow, rather I'm gently putting pressure into his glute to release that sciatic nerve. Go ahead and having a light grasp onto that left foot, you can rotate that lower leg and get different angles here. So pay very close attention to your client, listen to the sounds your client makes, and notice which areas are tighter than other areas. If you notice that it is abducting the foot, that creates tension and tightness, then you want to work on the TFL most likely. And if it's adducting, then you mostly want to work on the groin or the adductor muscles. And shaking it out. Palpating the body one more time. You can use some tapotement on the sacrum, and then go ahead and have your client turn over. We're going to go ahead and shake them out in a supine position, and then grasping onto their left ankle, we're going to bring the right hand underneath their knee to get a nice bend. And then you can rotate their leg from here. So again, noticing which areas are tighter, the outside or the inside. We'll make some nice rotations, nice and easy and gentle. And then wherever you feel like they're the tightest, this is where we want to work. I found that he seemed a bit tight in the adductors. So what we're going to do is bring the foot to the hip flexor and then rock the body forward. Remember, grounding into the earth, and then using your whole body weight to move his leg forward. And bring the leg back down. We're going to shake out the leg, and then we're going to bring it underneath the right leg, and then grasping onto their left ankle, and then bringing the left hand to their psoas. You want to go ahead and open up their hip joint. So this is super yummy to open up the psoas as you lean your body into their left psoas, gently pressing the palm of your hand into their hip flexor, opening their hip, keeping your body steady as you pull their left ankle towards you, and then bringing it back, shaking it out. Taking their right leg this time, we're going to bend the knee, bring the foot to the hip flexor, do the same thing as you did on the other side, leaning your body weight forward, coming from the grounding onto the floor through your hips, and then leading your body weight forward as they kick into you, giving you a bit of resistance. And shaking it out, we're going to bring the right leg underneath the left. And bringing the right hand to the right psoas this time, pulling the legs towards you. It's a really nice stretch for the hips and also for the TFL. Bringing their left leg up, we're going to go back to their left side and find that rotation. And then bring their foot to your left shoulder. As their foot's on your left shoulder, find the grounding with your feet. And then I like to bring one knee up to the table, and then just leaning body weight forward, having them push into your shoulder, and then leaning body weight forward on the exhale. Notice when you contract the muscle and then release, you go a bit deeper towards the shoulder. Now, this isn't a push and release technique. This is actually a resistance stretch, because as they're contracting, they're also resisting as you come forward. So there's always a contraction in that muscle with these stretches. You are allowing your body weight to come forward into their resistance. And coming back out of it, we're going to go ahead and lean forward once again. This time you're going to bring their foot on top of the left shoulder, and they're going to bend the leg as you lift up. So you want to protect their knee and then lift up with your body. So lifting up from your thighs, grabbing onto their knee, keeping it nice and safe. As they kick down, you're lifting to straighten their leg as much as it'll straighten. Remember, these are clients with very, very tight hamstrings and tight hips. So he actually can straighten a decent amount, but not everyone will be able to straighten a decent amount. So never push, never force, only go as much as your client can stretch. And then if you want to get deeper into the calves, you can flex their foot and press their foot flexed. They can kick down towards you with a straight leg as you lean your body weight forward once again, just like the bent leg, but this time keeping it straight. And after a few times, I like to lean my body weight completely forward, and this brings their knee all the way towards their shoulder. So at this time, they give a little resistance and then they melt that leg all the way down. Next, we bring the foot to a figure 4 position. So bending their knee, giving them some rotations, or bringing the foot to your knee for stability and balance. And then gently rotate their leg. So when I say gently, I mean very gently, as knees can be very sensitive and touchy. So be careful, but notice the rotation in the hip. Now, when it feels safe to do so, we want to go ahead and rotate the knee open and the foot towards their chest a little more. So what they can do as far as resistance is push their foot towards you, and then you bring your knee forward. Notice how this gives him a really nice rotation in that hip. And gently pushing their knee towards their chest. This is probably the best stretch for sciatica, is getting deep into the hips here. And then they can push the knee towards you, and then again, dropping your body weight into their knee and to their chest. So this should never be too taxing on your body as a practitioner. You should always use your whole body weight as opposed to just your arm muscles. And after you've done about 4 or so, we'll go ahead and do one more. Exhale, knee to chest, and then we'll drop that leg out with a gentle rotation outwards. And then crossing the leg across the body, we can bend the knee here and then take the opposite arm to gently push that thigh down. This is a really great spinal twist. If their torso is coming along with them, you can gently nudge their shoulder down towards the table. And again, using your body weight to increase their twist. And bringing the leg down. Very good. We're going to move to the other side. So taking that right leg, remember we're going to start by bringing the foot to the shoulder and leaning forward, opening up the hip from here. And then bringing that leg towards you. We want to kind of feel around to see the flexibility level. So you can come to increase the stretch or decrease the stretch. Notice where they're tight. I like to move like adducting and abducting so I can notice if they're tighter in the adductor or the TFL. Just like in the beginning, you're just kind of feeling around. Then we'll go ahead and bring the knee around. And remember, we're going to go for the bends and straightens. So we want to bring their heel to the top of your shoulder this time. And they're going to go ahead and bend the knee down onto your shoulder. And then you can come down as a practitioner, keeping it nice and steady, and then lifting up your torso to straighten their leg. Bending down and then lifting up, making sure that they're really squeezing their heel down onto your shoulder. This is creating that contraction in the hamstring. This is a really, really great way to break apart dense fascia behind the knee and also around the ischial tuberosity. Now, keeping their legs straight, go ahead and have them kick down into you. And then lift your body up towards them, keeping the leg nice and straight this time. For some clients, it's a little bit difficult for them to straighten their leg, so just do the best you can. And then have them melt that leg down, bringing the knee towards their shoulder. Nice deep breaths in here. We don't want to do any bouncing or anything like that. We want a nice and steady stretch. So always have them resisting just a little bit as you come forward. Very good. Releasing that leg now, we're going to come into that figure 4. So bringing their foot to your knee, lifting the knee up. Going to get nice and deep into the hips. We're going for that rotation. Next, bringing the knee in towards their chest and having them push their knee out towards you. Opening the knee when you're complete and drawing it across the body, bending the knee, and then pressing down for that spinal twist. This is always a nice way to end any stretches. Very good. Release into the twist, and then we'll shake their legs out. And then have your client go ahead and turn over on their belly for the upper body stretch portion. Once your client is on their belly, go ahead and have them relax. And we'll just go ahead and palpate to see what changes we've made so far with that lower body. So how we're going to start is we just want to palpate the upper back, the traps. So I like to take the olecranon. This is the part of the elbow that's closest to the upper arm. You just want to lean back onto the elbow to get to the soft part of the elbow, not the very tip of the elbow. That can hurt. So just work on the different angles of the elbow and then gently leaning body weight into this part of the arm. As you gently lean your body weight in, what happens is you can release knotted tissue, fascia that has been accumulated and form dense scar tissue. You can start to break this all down using the elbows. So that's what I really like about using this tool. You can take your hands as well and just palpate the area. I like to use my thumbs, but remember that when you use your thumbs, you always want to make sure that your thumb is in alignment with your elbow and your shoulder so that you don't tweak it out. And always lean your body weight into it as opposed to using the muscle. Very good. So we're going to go ahead and bring our attention to the right shoulder. We're going to open the right shoulder. You can stand across the body on the opposite side if this helps you gain access to this area. Sometimes moving signs can give you better angles, different angles. We're going to have your client go ahead and roll onto their left side now. We're going to go ahead and grab onto their shoulder by swinging the arm underneath their right arm. And then gently grasping around the shoulder, you're going to actually bring your fingers inside of the scapula and help to release the scapula away from the trap. Go ahead and cross your hands together. You're going to have your client shrug their shoulder up on the inhale, and then on their exhale, you're going to pull down. So this is a resistance stretch. As they're pulling up and shrugging up, they're creating some resistance as you pull the shoulder down. So it's not quite a seesaw where you pull up and then relax down. They actually hold some resistance on the way back down as well. This really helps to open up the neck, really helps to separate the trapezius, and really helps to relax the shoulder. You can go as slow or as quickly as you want. I always recommend the slower the better, the deeper you can get into the muscle. But I also like to let my client guide the stretch, so however they feel best is how I like to move with them. And after you've opened up the shoulder a bit, go ahead and palpate a little bit more. See if you can feel any knots dissipated or anything moved. You can also move the fingers up to the neck, all the way up to the occiput. Go ahead and have your client open their arm. You're going to bring your hand behind their elbow and they're going to press their elbow back towards you. This is a resistance stretch to really open up that scapula. So as they're pushing back, you're going to bring their arm all the way down. And don't stop right where the table stops. Keep pushing the arm all the way down off the table. This helps them get full range of motion, full opening behind that shoulder. Inhale, push back, and exhale, resist, and bring it down. The more they resist, while you're still able to push it down, the deeper the stretch is going to be. The more you'll be able to break apart fascia. And remember to use your whole body weight and not just your biceps. We don't want to blow out our biceps. Very good. So I tend to do around between 4 and 6. Really kind of depends on what their body needs. But if you're doing this with lots of resistance, even just 4 can make a really big difference. Go ahead and loop your left arm underneath their right elbow and gently pull the arm open. This releases the lats and helps them stretch their whole side body. Very nice. We're moving on to the other side. Go ahead and have your client lay on his right side or her right side. We're going to pull the left arm underneath their shoulder. And then you can palpate with your fingers underneath the scapula here and into the neck. And crossing the hands, you're going to have them shrug up on the inhale. And then slowly release that stretch as you pull down. So resisting and slowly releasing on the exhale. Yeah. You'll notice if you gauge to see where their shoulders are when they first walk in, and then you gauge to see where their shoulders are after the stretch, pretty much they always drop about 1 inch or 2 inches down. It's pretty awesome. It's really amazing to release this from your neck. Inhale, squeeze up. And exhale down. Go ahead and palpate and see what kind of difference that you've made. Again, just a few of these can really make a huge difference. And bring your fingers all the way up the neck and into the occiput. And you should start to feel the tissues soften up. And if you feel like they're still dense behind the scapula, like I did with him today, we're going to move on to that second stretch. You're going to have them bring their elbow pressing back into your hand. And then keep pressing back. Have them give you just a little bit less resistance as you push their arm back down off the table, using your body weight to push down. Exhale. Lifting up, pushing back. These stretches are so powerful as well because a lot of people who work out and do body weight exercises will go one way. So if you're doing a chest press, you'll go one way, but very less often they go the other way. And their body needs that. Their fascia needs that. So being able to push them in the opposite way that they work out, oh my goodness, literally a game changer. Exhale, pushing down. And then palpate around and see if you notice a difference. It was much, much softer after we had done this second stretch. And didn't take long. Go ahead and bring that left arm underneath their left arm and pull back. You're going to open up their lat. So good. All right, our last stretch, we're going to have our client lay on their back and then bring their hands together and then lay them by their navel. You're going to go ahead and ground yourself down into the ground, and then you're going to go ahead and bring your hands to their wrists and pull the arms up. So they want to keep their arms a little bit extended, and then exhale as you pull back. Remember that there's still resistance here, but only have them give you enough resistance so that you can manage it effectively and not get burnt out. Have them squeeze their core muscles in so their ribs stay down and they're not overextending. This should really be isolating for the lats, and they might also feel it in the pecs and in the triceps as well. Inhale down, and then exhale, have them squeeze their core down and isolate those arms. To finalize this routine, go ahead and have your client grasp onto your wrists, and then you can go ahead and just lean your body weight back, and this helps to nicely open up their spine and their neck and relieve them of stress for the rest of the day. I hope you guys enjoyed this video. If you have any comments, please feel free to comment below. If there's anything you'd like to see, let me know, and I'll see you in the next video.